topics and opinions expressed in the following show are solely those of the host and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert Show on W4CY Radio and Talk4 TV, where we bring you educational information from experts on such topics as legal, health, financial, and home improvement. Now sit back and listen to our experts in community association law, estate planning law, tax relief, Medicare, public insurance adjusters, neuropathy treatment, business brokers, and personal injury law, along with many other topics. Now here's your host for the last 17 years, Steve O.
Makes me sound old when they say for the last 17 years, but we've been doing the show for 17 years. We started off with 30 radio stations across the country. And about 3 years ago, I was convinced that going through a podcast would be much better than radio. And I got to tell you, you're going to hear kind of a happy voice today. I want to welcome our TikTok audience. We started with TikTok last month, and it was really nice about TikTok. It shows the amount of people who are listening and viewing our show. We have a new record. That's why I was going to say my voice sounds so happy. We're over 5,000 people watching on TikTok. That's our new record of all of our shows we've done. Medicare is our first show this morning. Such an important area. Hey, I'm on Medicare. I'm not embarrassed to admit it. There's so many things that I didn't know that I wish there would have been a show like this when I entered the age group for Medicare. We have got the top Medicare agency in the New York area, Alcorn and Associates. And let me introduce you. I love it. Dan brings on many of his associates. And today we've got Chris Amorosi and we've got Kate Barkley, who is showing off. She's in the sun. And I'm in Florida, so big deal. That's all I ever get is sun. Good morning, everybody.
Good morning.
Good morning, Steve. Thanks for having us.
Oh, man, we love having you. I got to tell you, I am so happy that Medicare is one of our top shows because I went through not knowing anything about Medicare, and it cost me dearly, and you all know what that means. I had some penalties that I'm still paying on, and I don't want people to go through that. And the second thing is I didn't have an agent at first, and I've learned how important it is to have a good agent that's going to take care of you. Dan, tell us about Alcorn and Associates.
So we are a group of independent licensed agents. We're based in New York, but work in other states, including, Steve, your home state of Florida. We are not employed by the federal government or any one insurance company. We represent 8 or so different companies offering Medicare Advantage, Medicare Supplement, and prescription drug plans. And we work with individuals on a one-by-one basis to help them identify coverage that matches their doctors, matches their prescription drugs, their upcoming health plans, and of course, their budget. And so we work as a team. And so we have, collectively thousands of clients who, we don't sell anything, Steve. We try to interpretate the language of the government, translate it into simple English, and then educate folks on what today most closely matches their needs.
You never know, Dan and Chris and Kate, who's listening or watching. with 70 platforms, we've got a very large audience. We just got a note from TikTok, someone who's watching. He said, I saw the promo coming up about the show and I saw Alcorn Associates. My mother is taken care of by your company and I helped her through it. And I just want people to know what a great job you did walking her through this. And I didn't even have to write a check.
Right.
And
That's a good point. Yeah, we do not
understand.
charge for our services. Through the government and through the insurance carriers, they help us help our clients. So yes, it does not affect their premium or in any way adversely affect your benefits to work with a local independent insurance agent to again navigate the complicated.
Dan, you said the word independent. I'm going to tell you what I did. You see all these national commercials and you think, wow, what a great deal. And this applies to me. And when you call I'm not putting these companies down or their commercials, but when you call that company, all you're going to hear is what they offer. Whereas when you contact Dan and his associates, they represent a lot of companies.
Right.
So you're going to be able to show them many plans.
Exactly.
And to your point, Steve, is when you do call those numbers, you're basically calling into a huge warehouse somewhere in the Midwest, and you may be talking to Bob. And if he enrolls you in a plan and now you have a problem, you're never going to talk to Bob again. So, one thing I got to say for our team, and I'm speaking for all of us, if any of our clients need us, they're right. Our cell phone, they have our cell phone numbers. So they call us directly.
And there's companies that are pulling out of markets all the time. So you might think that you're okay and you don't have to do anything. When you have an agent, your agent is going to tell you if, for example, Humana has pulled out of your area.
Absolutely. We're throughout New York State, and so Kate is in the north country of New York State. One of our other agents who's been on the show, Alicia, based in New York and Long Island, and is each case very much aware of what the local hospitals and provider groups, where they are with their contract status with these various insurance companies. You're not going to get that through an 800 number or 800 Bob, as Chris said. They're just not aware of what's going on everywhere. So, we keep our eyes and ears on the ground and relay that information to our clients.
I'm looking at our TikTok questions that we're getting. We have got probably 14 or 15 questions on the injections, the weight loss injections that everybody has been hearing about. And I know that I saw the president make an announcement that starting July 1st, that
Right.
these copays are only going to be $50. Is that right?
Well, Steve, you brought this up last month, and we were talking about it's called the GLP-1 injections. Right. And Medicare has been covering that for individuals diagnosed with diabetes for some time. And in fact, in last month's conversation, we were talking about how that is costing the insurance companies so much more money. In fact, in yesterday's Wall Street Journal, there was an article about employers are also facing enormous costs with their employees, non-Medicare, obviously, on these GLP-1 medications. And yes, July 1st, the federal government, independent of the insurance companies, so this is not going to be billed to the insurance companies, will be offering on a temporary basis this GLP-1 for weight management to some people for some drugs under some circumstances. So it's not a blanket, but it's a first step towards that.
Why do
Anything
you
you want to add on that, Kate?
Why
want
do
to
you
add to
say
that?
temporary, Dan?
Kate, can you hear us? I'm not sure she can hear us. Well, the program is approved, Steve, July 1st, as you point out, through December 31st of 2027.
Okay.
This is not going to be billed through the insurance company. Taxpayers are paying for this, and it gives the government a time frame to at least help make these GLP-1 medications more affordable, while figuring out the medical effects and the long-term coverage models as to where they're going to go with this. It's been approved through Part D, the drug plan for diabetes, but for weight loss, this is it's a temporary, it's a welcome relief. But it begins in July, runs through the end of next year, 2027, and at that time, we'll see what they do to extend it beyond that. There's also some limitations. It's not everybody.
Right.
And I don't think the government really knows the financial impact that this is going to have. So I'm wondering if this is, that's why they're doing this trial basis, to see if they're getting in over their head. Is that possible?
Well, it's hard to speculate what, they're thinking, but so for example, on our website, Steve, we've posted actually 4 things that folks should know about this GLP. It's called the Bridge program.
Okay.
On the website, and we can go over this, we identify who is eligible, which medications are eligible, not all of them, the fine print. Chris touched on this last month when we spoke, and the action steps. So let's start with, if you want this GLP-1 for weight loss, you just don't show up at your pharmacy with a prescription and pay $50. So first of all, you have to be enrolled in a Part D plan,
Okay.
which is, you could have a standalone Part D plan, or you could have drug coverage included with your Medicare Advantage plan. You have to be in one of those. Now, some of our clients are enrolled in a Medicare Advantage without prescription drugs. They may get their drug coverage through the VA. They would not be eligible for this program, for example. You have to have a BMI, body mass index level, with some other health conditions. And it's sort of a tier for that. And again, it's on our website. So
You have to have diabetes, Dan?
in fact, the folks with diabetes are not eligible for this because diabetes is covered already.
Okay.
So this is for individuals without diabetes who are enrolled in a drug plan of some sort and have BMI levels corresponding to high blood pressure, kidney disease, heart conditions, etc. Excuse me, Steve. Then if you pass those 2 tests, there's not every medication. Right now, it's 2 of them. Wegovy, 2 of them. 3 of them, Wegovy, Zepbound, and Foundayo. It's an Eli Lilly medication.
Oh, that's the new pill, right?
Yes, it's an oral pill, yes.
Yeah, I saw the commercial last night for the first time on that.
So those are approved. The Ozempic and Mounjaro are not part of this because they're already approved under Part D for diabetes.
Right.
See how there is some fine print with all of this. It's great news, but it's not a blanket. Just walk in and get your weight loss drug for $50.
I'm going to share something with you.
Sure.
That because I'm on Ozempic, I do not have diabetes. Mine was kidney, and I've got a great copay. But here's one thing that people don't know about is I had stage 4 kidney failure. Doesn't get any worse than that.
Mm-hmm.
Since I've been on Ozempic, and they tell you you're not going to get better. You just want to keep it from getting worse. I have one of the greatest neuropathy, the doctors in Florida. Since I've been on Ozempic, my kidneys are down to stage 2.5. And it's because of Ozempic. So I could care less about the weight. It's like, look what it's done to my lab work. And I don't hear anybody talking about that because it's still fairly new.
So one of the, again, on our website, one of the action steps is there's a document that the government put out for prescribers, your doctors, to follow the steps, and it's available for download. What we recommend is that you print that out, bring it to your provider, and if you or any of the provider's other patients meet the requirements, then there's some steps there on how to get this pre-approved and build through. In this particular case, it's our understanding that Humana is actually doing all the billing for this, even if you're not a Humana client. The government has just contracted, I guess, with Humana to do the billing for the pharmacy, and then the taxpayers are paying for it. It's not going through your Part D plan. Steve, you brought up something last month, and Chris touched upon it. The fine print in this is that because this bridge program is independent of your Part D drug coverage, whatever you pay, if you're paying that $50, does not count towards your maximum drug cover, your maximum drug cost of $2,100 annual. So if it's $50, that's $600 a year, would not count towards that $2,100. If you are enrolled in what's called Social Security Extra Help, that's income based, or for our New York viewers who are enrolled in a program called New York State EPIC, EPIC. Extra Help and EPIC do not apply here. And the other fine print is that you're only prescribed a 28 or 30-day supply. So you can't load up on 6 months worth of this and then go away. So, I mean, those are things that folks need to know, is that there are some requirements. You have to be enrolled in a Part D plan. You have to meet these BMI. Is a scale based on what other conditions you may have. There's certain medications, and Chris mentioned the new one, the Eli Lilly's oral pill, but Zepbound and Wegovy, Ozempic and Mounjaro are not part of it. There is some fine print, and your doctor has to get prior approval through Humana, who's managing this on behalf of the government. And all of that is on our website for viewers to go. And by the way, the website is www.dgalcorn.com. And just Google GLP-1 and you'll see it. Excuse me, or search GLP-1 and you'll see it right on the site.
So we're now well over 6,000 people now on TikTok. Thank you so much. People wanting to know, when should they start enrolling for this year? At what month or date?
Well, you mean for 2027 or 2026?
This is 2027.
Right. Well, Kate, you want to talk a little bit about the schedule? Kate, can you hear us?
I think she's on mute.
Yeah.
She's on mute. She can't hear us. So, Chris, you want to talk about how the schedule begins with ANOC in September?
That's so by September 30th, all existing clients will be getting what's called their annual notice of change, explaining the differences from their 2026 plan to what's going to be happening in 2027. And then the we just sit back and wait for that wonderful October 1st date where we can physically talk about the new changes for 2027. And then October 15th through December 7th is the period that people can enroll, make changes. And then from after that, that will become effective January 1st. And then from January 1st to March 31st, they are allowed one more change for the year. But the main time frame is October 15th to December 7th.
Right.
We only have a minute left, so I want to just, people, please, one of the purposes of the show is get a good agent like we have here with Dan Alcorn, and don't try to do this yourself. I'm telling you, I know by experience. Dan, how do they reach your office?
So our main line is area code 518-346-2115, or the website www.dgalcorn.com. You can get a message to or get it scheduled to any one of our agents' calendar for a no obligation, no sales approach, complimentary consultation to just review your plan and see what might meet your needs in the future.
Beautiful. Guys, thank you so much. I'm so sorry Kate was probably muted. And thank you again. Give them the website one more time, Dan.
www.dgalcorn.com.
Beautiful. Thank you so much. And folks, don't do what I did. Get on this right away. We've given you a great agency. And we're going to go to a break. We'll be right back.
Thank you, Steve. Have a great day.
Thank you, Steve.
You too.
Bye.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.